So when we think about functional behavior assessment, there's some values that are really strongly attached to our assessment process. And the first value is the dignity of the person, right? So that's the very most important thing of all. So nothing that is done in terms of assessment should compromise that person's dignity. Like I've said a few times already, another really key understanding is that for the person who is engaging in problematic behavior, that behavior is absolutely reasonable. It completely makes sense. There's a really good reason that they're doing that. And we need to understand that. They're not doing it just to get under our skin. They're not doing it just to be problematic and to make our lives difficult. And I understand, particularly as a parent, it can feel that way. Right? I worked in a classroom, and I remember some of my early days, and it felt that way. It felt like there were kids that were coming to school just to make my day challenging. But the more I learned about behavior, the more I recognized that no, these kids were doing the kinds of things that they were doing for really specific reasons, and it was my responsibility to figure that out and understand that, and then help perhaps show them a different way, and also to make some changes in how I did things so that they were less prone. They didn't need to use those kinds of behaviors, okay? So that's a really key thing that we keep in our heads at the forefront of our minds when we're doing assessment. Our goal in a functional behavior assessment, beyond just understanding what problem behaviors are occurring or trying to get rid of those, it's really about understanding that bigger picture around behavior. So not just going, well, here's a bunch of problem behaviors we don't like and we want to go away. It's really about understanding what else is happening around those behaviors that we need to make some changes about, right? And if the person doesn't have other skills in their repertoire, what are some of those things that we might need to teach, okay? So we're really interested then in this sort of match between behavior and environment and knowing that these two things are linked. So we can't change behavior without changing the environment in which that behavior occurs. So that's part of our job. If we just focused on trying to change behavior, we would find ourselves doing the kinds of things that used to happen sort of in the olden days, which were not pleasant for the individuals on the receiving end, certainly. So we really do want to make the environment a key area of our attention so that we can understand what is it in the environment that leads to problem behavior and how can we change those things. So our goal then certainly is to identify the problem behaviors of concern. I need to know what they are so that I can explore the environment around them. But once I know what those behaviors are, the next thing that I'm interested in determining is something called setting events, okay? So think to yourself, how many of you had coffee this morning? I had a couple cups, right? How many of you know that if you don't have some coffee in the morning, perhaps your day and the day of those around you, not going to be so good, right? So that's a setting event for many of us, coffee. And if we don't have coffee, it's going to be a problem. And we manage those setting events. Well, we want to know for individuals what are the setting events that might kind of push them a little closer to the edge of engaging in problematic behavior, right? And so I always use coffee because for lots of us, coffee is a key thing, and it's sort of the first thing that we stumble to as we peel our eyes open in the morning. I've switched to water now, but I had my coffee. We're also interested in understanding antecedents. So antecedents are those things that trigger problem behavior. It is like lighting the match and the behavior happens. Then we're interested in understanding what the consequences are. What's the payoff for the person? Why are they doing this, right? And from all of that information, we can then get to something called the function, hence functional behavior assessment. We want to know what the function, or sometimes functions, of behavior are. So again, I'm going to say this a whole lot because if you go away today with only one thing, the one thing I want you to go away remembering is that behavior serves a purpose. And the purpose is totally logical for the person who engages in it. So remembering that, A functional behavior assessment then helps us identify that purpose, okay? And essentially we're trying to answer a couple of questions. What does the person get from engaging in problem behavior, and or what might the person avoid by engaging in the problem behavior, okay? And so those are the things that we're trying to figure out. It helps us understand if there are things in the environment we might need to change. And so essentially to figure this out, we are looking at the payoff. The payoff for behavior helps us identify the why or the function. So there are 4 common functions of behavior. The first one is something called tangible. We're going to look at some examples in a minute. The second one is called attention. The third one, escape or avoid or delay. Sometimes you don't completely avoid something, but at the very least you manage to put it off for a while. And then the fourth one is automatic, and so we'll talk about that in a second too. But to give you a couple examples of each, so here's an example of a situation where the function is probably tangible. So Jennifer's got her iPad, she's playing away happily, and for whatever reason, maybe it's dinner time, maybe it's time to move on to something else, but mom comes and takes away the iPad. Jennifer screams, and mom usually then gives the iPad back. Mom's not really a fan of listening to the screaming, and frankly, right, mom wants the screaming to stop, and the best way to make the screaming stop is to give Jennifer the iPad back. Everybody's happy, okay? So now though, whenever mom takes away the iPad, Jennifer is screaming like faster and louder, and she's doing a lot more screaming because what Jennifer has learned is if I want the iPad back, scream. And in fact, mom has learned something too. If I want the screaming to stop, give her the iPad. And, you know, in the long run, this is probably not the best way for Jennifer to get the things that she wants, right? And it's also probably not the best way for mom to respond either, right? But we're kind of caught in this situation now because it's the only way that everybody is kind of happy, right? So we understand that. No judgment, absolutely, right? If it were me too, stop the screaming, have the iPad. I don't care, right? Especially after a few months, weeks, months in lockdown, right? It's like, here, have the iPad, whatever. Here's another example. Jack goes into the kitchen and he stands in the middle of the kitchen and he cries. Dad hears him crying. Dad comes in, opens the cupboard, takes out Jack's favorite cookies and gives one to Jack. And now, like, Jack's running into the kitchen, standing in the middle of the kitchen and screaming, crying all the time, right? Why? Well, because he wants a cookie, right? And Jack doesn't know another way, and standing in the kitchen and crying is working really well. So why wouldn't Jack do that, okay? Attention. So here's an example of an attention function. Dad's busy helping a sibling, right, with homework. How many of you are sick of helping your children with homework? Yes, okay. But here you are, you're helping with homework. Matt hits the wall with his toys. Dad comes in and plays with Matt to keep him occupied, settle him down, right? So now Matt's hitting the wall more and more often when he's left alone and the adults are occupied than he used to. Because what he's learning is if I'm all alone and nobody's paying any attention to me, I'm kind of bored. If I hit the wall with my toys, somebody always comes and plays with me. Makes perfect sense, and it works. Okay, here's another example. Some of you may know this example too. Mom's cooking dinner. Savannah hits and bites her sister. Sister screams, right? Mom comes in, says to Savannah, stop hitting Phoebe. Here, play with this. Mommy needs to cook dinner. You play like a good girl, okay? So she gives her a toy and she gives her some attention. She talks to her a bit, right? And now Savannah's hitting her sister more often when mom is off cooking dinner. So what Savannah's learning is if mom is busy being occupied and I hurt my sister, mom will come. Perfect, okay? If we think about escape, avoid, delay, here's an example of that. It's mealtime. There's Sam. Sam's parents ask him to eat a meal, and Sam starts spitting and kicking the table, okay? Well, the parents have learned if you keep at Sam asking him to eat, he's just going to keep spitting and kicking. So they just kind of go, yeah, right, whatever. They don't keep asking him to eat the meal, and they just let him kind of graze throughout the day instead, because a kid has got to eat, of course, right? We're not going to starve the kid. So they just sort of keep food set out. Sam eats whenever he's hungry, and they don't ask him to sit at the table and eat a meal anymore. And so what Sam learns now is that anytime somebody tries to have him sit at a table and eat a meal, if he spits and kicks, they're going to let him go, okay? And here's another example. Dad tells Melanie it's time to stop playing on the trampoline, right? She's out there playing happily, and come inside. Melanie continues to jump on the trampoline. And so Melanie's dad kind of goes, well, I've been here before. I'm just going to leave her for a few more minutes, and then I'll try again, right? So he leaves her for several minutes, and then he comes out and asks again, and eventually he has to kind of climb up on the trampoline and get her and physically bring her into the house. But what Melanie's learning is, if Dad asks and you just keep jumping, he'll go away for a while and you'll get more trampoline time, right? Again, it works, right? And it makes perfect sense. If Melanie wants to stay on the trampoline longer, just ignore Dad, because he'll go away for at least a while. Eventually, he's going to crawl up there and haul you back inside, but at least, for some time, you're going to get to stay out there. So Melanie is learning that. And then finally, automatic reinforcement, which we're not going to talk a lot about today because it can be a little bit trickier to address. But automatic reinforcement has to do with a behavior where you provide your own payoff. So in all of these other situations, in tangible, somebody gives a thing to the child. In attention, somebody gives attention to the child. In escape, somebody sort of allows escape from a demand, right? And in automatic reinforcement, people engage in behaviors and essentially reinforce themselves. So these are behaviors that look good, feel good, sound good, taste good, smell good, whatever, right? From the perspective of the person. So for Roxanne, if Roxanne doesn't have anything to do, nothing's happening, she's got no one to interact with, she makes some noises and she flaps her hands. And nobody comes and does anything. Nobody brings her a cookie. Nobody comes to play with her. Nobody removes a demand. Nothing happens. And so she just keeps doing it. And so she's doing it more often now. Is this necessarily a problematic behavior? Not necessarily. I mean, I suppose if this was all she was doing, my question would be, why is she alone with nothing to do all the time? And maybe we should look at some interesting activities to do. But is flapping your hands necessarily a problem? No, right? And we all do little things like this. You're all at home right now, and no one can see you. And how many of you are jiggling a knee or tapping your fingers or twirling your hair or doing something else? It's the same idea, right? Here's another example. After folding a few shirts, which for Garrett is a somewhat difficult task, he stops, he hums and he rocks back and forth for a minute. Nobody notices, nobody says anything. And after a minute or so, he goes back to folding shirts. And so he's doing this a bit more often now because he essentially needs a break. And again, is this necessarily a problem? I wouldn't say so, right? But this is an example of automatic reinforcement. And again, you are likely to do this today. You're sitting in front of a screen, and we are all so Zoom fatigued right now. We are sick of looking at screens and watching people talk. Right? And so at some point in time, I bet you look away from your screen, you rub your eyes, maybe you get up and walk around the room a bit, all kinds of things you could do. You could get sick enough of my voice that you turn the volume off. All kinds of things you could do. You take a little break, and then you go, all right, here we go again. And then you come back to it, right? And again, is that necessarily a problem? Not at all. You're just taking a break when you need it, okay? Can there be automatically reinforced behaviors that are problematic? Absolutely, right? So I've worked with individuals with quite significant multiple disabilities who, for example, headbang or eye gouge until they're bleeding, right? And they're doing it for an automatically reinforced function, and they're hurting themselves. So we need to get to the bottom of that. But there are lots of other things that, if they're not interfering with daily life and they're not interfering with quality of life, who cares, right? Not really that big of a deal. So it's not a mountain that I'm usually willing to die on. unless it's a harmful behavior that somebody's getting hurt by, or it's really stigmatizing and really interfering with quality of life.